Hello, my name is Arie Dijkstra, Professor Dijkstra. This video is about cognitive skills that are formulated in the learning goals of this course. In the field of psychology, theories, concepts and models comprise the main body of knowledge. Students are expected to know and understand these theories, concepts and models. However, this knowledge is only the start. There is little use to this knowledge when it does not help to understand and influence reality, the behavior and the psychological processes that are related to health and illness. Because that is what academic professionals are expected to do, to influence reality, themselves or through others. Therefore, academic professionals need to master the cognitive skills to go from knowledge to influence. In the past, it was thought that knowledge kind of implied being able to influence. When you have knowledge, you have control. Well, now we know better. We have mapped in more detail how professionals can be effective. Cognitive skills play a central role. Cognitive skills can be very different as the skill to drive a car is from the skill to manage a hospital. Professionals deliver an action or service called a professional product. This is what they do all the time. This is what they are paid for and why they are needed. In practical psychology, the professional product can be a diagnosis or assessment, an advice, or an intervention. The professional products are developed through a professional method, a stepwise process in which all kinds of knowledge are gathered and combined to compose the professional product. Each of the 5 steps that are distinguished in this depiction of the professional method is a task in itself. Assessing concerns gathering information from various sources. Determining possible solutions demands understanding of the determinants of change. Preparing the intervention is developing a plan and gather the intervention elements. Delivering is actually influence the situation. And evaluating refers to generating feedback. These steps need more than knowledge. In each step, several different cognitive skills may be used. I distinguish a limited number of core cognitive skills, but there are many more. It starts with the skills related to what we normally refer to as knowing. The skills are storing and retrieving knowledge on theories and explaining theories. Thus, knowing refers to actions, to cognitive skills. Besides these basic skills, applying theories and integrating theories are used. To actually influence reality, designing and evaluating are important cognitive skills. Thus, cognitive skills are in the function of the professional method to deliver a professional product. The professional method in itself can also be seen as a higher order cognitive skill that makes use of more specific cognitive skills. In the present health psychology course, the learning goals are about these cognitive skills. After this course, the students should be able to describe the phenomena of health behavior, adjustment to illness and changing behavior, explain the most important theoretical perspectives to understand these phenomena, reflect critically on the theoretical perspectives, integrate the theoretical perspectives, apply these theoretical perspectives to real-world phenomena, explain how to design simple and complex interventions, and explain methodological issues in research. Okay, describing the phenomena of health behavior, adjustment to illness and changing behavior refers to recognizing and retrieving from memory what phenomena around us belong to the field of health psychology. It is about the manifestations of health psychology. For example, in health statistics, in policy measures, in healthcare costs, but of course in individual suffering and in individual behavior. This description belongs to the professional identity and the unique expertise of the health psychology. One core question that can activate this skill is, what things do you observe that belong to the field of health psychology, and why do they? Explaining the most important theoretical perspectives to understand these phenomena refers to showing insight into theories, concepts and models in health psychology. For example, it's not enough to only know that the theory of planned behavior contains 3 determinants, which lead to intention formation, which leads to behavior. Particularly, the relations between each of the elements must be explained in detail. Attitudes determine intentions, but how do they do this? How can we explain this? When you can explain this, you understand it. One core question that can activate this skill is, how are the elements of a theory related in the sequence of psychological and behavioral events? Reflecting critically on the theoretical perspectives refers to being able to recognize the shortcomings and limitations of theories, concepts and models. This starts with acknowledging the ultimate complexity of reality and our limitations to understand reality as it is. Our theories, concepts and models are only superficial descriptions of reality, and they are mostly imperfect and only true under certain conditions. One core question that can activate this skill is, what are the limitations of the theories, concepts and models, and why are these limitations? Integrating the theoretical perspectives is needed to approach the complex reality. Psychological theories, concepts and models only give a limited perspective on psychological phenomena. Therefore, they often must be combined to approach reality. But when we combine them, we notice that they mostly are qualitatively different. They use a different language to describe similar phenomena, but they may overlap. For example, what is the difference between attitudes and expected outcomes? All theories have unique aspects, and they may also complement each other. One core question that can activate this skill is, how are these theories, concepts or models related, and what do they have in common? When you master these cognitive skills, you are ready for the next level. Apply theories. Applying theoretical perspectives to real-world phenomena lays the foundation for influencing reality. Applying theories means that you see the theory in action, that you recognize the processes that are defined in theories in reality, that you observe manifestations of the theories, concepts or models in human behavior, in what people do or in what people say. Interestingly, it always demands some confidence to decide what an observation means. At a high level of applying theories, you are aware that the psychological phenomenon is the real thing that you try to approach, but that you can describe it in different ways using different theories, concepts and models. You can choose and combine theories to describe the underlying psychological processes that are important in a specific case. There are some pitfalls in applying theories to specific cases. On the one hand, people differ very much, while theories stress what people have in common, the general patterns. On the other hand, people often seem so unique, caused by unique situations and histories, but they indeed are also very similar. Therefore, one aspect of applying theories is measuring, testing, or just asking whether your assumptions are correct and what the actual state in the specific case is. One core question that can activate this skill is, what available information refers to what theory, concept or model, and what does this imply about the case. Once the psychological states or processes involved in a specific case or group of cases are described by applying theories, we can think of influencing the case for the good. We can start designing an intervention. The formulation explaining how to design simple and complex interventions implies that in this course students are not actually designing interventions, but that they will be able to describe how an intervention should be designed. There's another course in the social psychological master curriculum that teaches designing interventions. Designing interventions can be regarded as a higher order, complex and composed cognitive skill in which many different types of specific cognitive skills come together. Nowadays there are several stepwise procedures to design interventions, but they roughly all come down to what I called earlier the professional method. One popular and early protocol to design interventions is intervention mapping. This is one possible professional method to develop interventions in public health. Students must be able to explain the steps of intervention mapping. In building the actual intervention, as a policy, in a leaflet, a website, in protocols, in a training, behavior change techniques or BCTs are applied. This can only be done when the psychological processes that underlie the problem and the solution are identified. One core question that can activate this skill is, how can we decrease the problem? To know whether the intervention was effective, the effects need to be assessed. Therefore, explaining methodological issues in research is relevant to learn about the validity of theories and to generate feedback on professional actions. Students need understanding of the methodological issues. They must be able to understand and judge empirical studies. In this course, students at least need to understand and thus be able to explain the methodological issues of the empirical studies that are part of the course literature. One core question that can activate this skill is how valid, generalizable and important are the outcomes of this study. In this course, there are different ways students can learn and practice their cognitive skills. In the online meetings, the most important and complex skills will be dealt with. I will model the skills and you can work in groups to work on the skills. The focus will be on applying theories, integrating theories and designing interventions or explaining the design of interventions. In line with this, the exam will focus on these three cognitive skills. In the exam, students will be asked open questions that are designed to assess the use of these cognitive skills. During the course, you will learn more about the exam and we will practice exam questions. See you online. Bye.